Let me shift to opioids. As I mentioned in my opening, what we're seeing with the opioid epidemic in Indian country is just shocking. And the efforts that you have outlined, 150 million devoted to opioids in the budget request, I mentioned that my concern is that these funds are not directly in your budget, but that you're relying on funds being appropriated to DHS, and then those funds being transferred to the agency. Is that correct?
Not exactly. The funds that have been provided up to this point, the 2018 omnibus provided the Substance Abuse and Mental Health Services Administration with $50 million targeted to Indian country. And we have been providing technical assistance to SAMHSA about the mechanisms that we've used, the funding distribution formulas for our SDPI program as an example, so that they can make the best use of those funds and get them out to help as much of Indian country as possible. So there's no contemplation of moving that $50 million over to the Indian Health Service, but we are providing them with a lot of expertise in the way that we put money out to Indian country.
So again, I'm not sure why we are not being more aggressive in this budget, in your budget, with regards to those resources directly to your budget rather than through DHS. You know, my concern is there is extraordinary need out there all over the country, and if you don't think that every one of us is not going to be fighting for a significant share of that of those dollars within the budget to go towards opioids, you know, you haven't talked to everybody else out there, because it's very keen, because the need is so high. So my concern is that IHS will not get the resources that it needs. And again, we're talking about a population here that is more significantly impacted than any other population in the nation right now. And so the fact that we would not be addressing it more aggressively to ensure that those dollars come here is a concern of mine. I have more that I want to speak to on this, but let me turn to my ranking member.